that's some place, maybe through this podcast, we can put it out to the people that it's okay to come out and say that I'm not okay and I need help. If they are positive, go to your doctor, go to your healthcare professional, and ask them that what needs to be done about this.
When we talk about diabetes, it is only restricted to blood sugar levels, but there is such a deep connection between mental health and diabetes is something we are going to explore. So what does the term, the hidden loop, actually mean in terms of medical science?
So we talked to them about the connection between the two ends, that is mind and metabolism. A lot of people still don't understand how important mental health is, and not just for somebody with diabetes or obesity, but even for normal people like you and I.
Right.
Person who is, let's say, suffering from anxiety and depression may or may not know that he's having those mental conditions.
Right.
He or she might have a dysglycemic condition or say have a deranged metabolism. On the other hand, somebody with a deranged metabolism, say his or her body produces a lot more insulin, there is dysfunctional adiposity, there is central or visceral fat deposition. All of those people, in a way, have so much of prejudice running around them in terms of, say, body shaming, somebody calling them, ab tum mote ho. And that's a very common thing. Hey, mote, meri baat to suno.
So casually said.
It's so casually said. That impacts the person's body image. That leads to anxiety, that leads to depression.
The mind and metabolism are deeply interconnected, as you said. It proves that health is not just about the food or exercise. It's also about emotions, response to stress, and mental balance.
Whenever somebody has a sort of an anxiety, what it does, it increases your stress level hormones. So those are the cortisol and the adrenaline. So when somebody will tell you, oh, aaj ye aap nahi khana, you are a diabetic. How would you feel?
Right.
So that is how that diabetes is again precipitating the anxiety and depression for that person on a long term.
It's a loop.
It's a loop, and it's a loop which is so difficult to break.
So ma'am, it almost feels like a trap. Stress affects sugar, sugar affects mood, and the cycle continues.
आप stress में हो, मैं stress में हूँ. People listening to us are under the stress. ये podcast कब खत्म होगा, मैं कितना सुनूंगा? And it is a trap. You have to very consciously seek help to get out of this.
Right.
You need very qualified professionals who can help you with this.
The reason that the older generations they still feel it's a taboo seeking help for any a condition like this could be also the society difference of joint families to nuclear families, how it has evolved. Our generation before are sorted, they know that it's a taboo. The generation next are very clear that they need help. So correct. We are the ones who are transitioning.
The ones who are troubled. Absolutely.
So when someone is diagnosed with diabetes, doctors focus on HbA1cs, medications, diet and exercise. But mental health often gets overlooked. So should people with diabetes be routinely screened for anxiety and depression? Whether this screening itself creates more anxiety and depression, I don't know. But what should be the approach? Hello everyone, and welcome to yet another insightful episode of Azkka Virtue Podcast. In today's fast-paced world, stress, anxiety, depression, diabetes, and blood sugar imbalances are becoming more common than ever. What many people don't realize is that mental health and blood sugar are not separate issues. They are deeply connected in a powerful and often invisible cycle. This connection is known as the hidden loop, where mental health can impact blood sugar and blood sugar can impact mental health, creating a continuous vicious cycle. To unfold this loop, today we have with us Dr. Dhruvi Hasnani, co-founder and consultant diabetologist at RIMS and Niramaya RIMS Clinic, Ahmedabad, a center known for its excellence in patient care and clinical expertise. We are truly honored to have you, ma'am, with us today. Your experience and insight will help us understand better how people can protect both their mind and body. So, ma'am, it's indeed our pleasure to have you for this conversation, which I'm personally very excited about.
Thank you so much. Thank you for having me. Thank you to the entire team of Azkka. And it's wonderful to know that both of us started our journeys together.
Absolutely.
Yeah. Thank you. Let's have a wonderful conversation to look forward to.
I'm excited. So, ma'am, what originally inspired you to become a doctor, and how your purpose evolved over the years, especially as a co-founder of RIMS and Niramaya?
So I have a very simple story when somebody asks me this. Since childhood, I never knew there was any other stream of occupation.
Oh,
My father was very ambitious in making me a doctor. Here
okay.
I am sitting in front of you, and things accidentally fell into place with good scores. One fine day, when I was, after my graduation, I was looking out for some good roles. One of my friends said there's a medical officer ka vacancy, at
Right.
Dr. Banshi Sabu's place.
Okay.
And I landed up there, and then the rest of it is history, as a lot of people call it. I've
Right.
had a journey in diabetology since the very start.
Wow.
Um, I started to get some scholarships to study further,
Mm-hmm.
and I became a pediatric diabetologist.
Wow.
It was a scholarship through ISPAD, which is an International Society of Pediatric and Adolescent Diabetes.
Mm-hmm.
And after 8 long years in the
Wow.
same place, my mentor, Dr. Banshi Sabu, and Dr. Vipul, who a lot of people know, both of them wanted to do something as a new venture, and
Okay.
that was the time when they thought that I was the right candidate to start with.
Wow.
So that's how my independent practicing journey in diabetology also started. And later on, again, I got a scholarship to study endocrinology.
Okay.
And that's when I did my post graduation in endocrinology from the University of South Wales. And when somebody asks me what's the conviction that you have, or what's the thing that drives you to keep on working in the medical sector, and I always say that making a difference in somebody's life when they come back to you and said that it's not the medicines, it's how you have treated me.
Yeah.
It's how your care has changed the course of my life. I think that's what matters.
So true.
It might sound very altruist, when a lot of people like me say this, but it is true. A lot of us do want to become successful. All of us are ambitious. But when, again, the conversation of our topic today is something which talks about mental health, it is the doctors who ease the life of people living with disorders,
So
be
true.
it acute or chronic. And we are in 2026, and a lot of us are struggling with the identity of becoming a doctor as well.
Right.
And there are a lot of podcasts wherein discussions keep on happening whether the next generation should become doctors or not. A lot of second generation doctors, or second generation or third generation, do not want to become healthcare
Right.
professionals because they've seen how the transition in the society has happened. But we'll have to reinstate this fact that we want to give a good quality of life to people with any type of disorders they are living with.
Right.
And at the end of the day, that is what matters. That you bring a smile to somebody's life,
So
you
true.
make them happy, you take away their pain, and that's what the medical profession is all about.
Very true. Very true. So, ma'am, taking a clue from what you said, I mean, that is the ultimate satisfaction, you
It
get
is.
when you retire to the bed for the day.
Absolutely.
Uh,
It is.
Right. So, ma'am, as we were talking off cameras also, about your journey, like your father's ambition,
Yeah.
and today 8-year-old, long journey.
Yeah.
Uh, I think what we were discussing is very true that, when it is destined to happen, it just happens. Everything starts falling into place, and
True. True.
ultimately, I think for the larger good of the society, uh, the way the RIMS is taking up the steps, I think it is fantastic.
Thank you.
Uh,
Yeah.
so taking this conversation forward, ma'am, uh, personally for which I am very excited, because this is not much talked about. When we talk about diabetes, it is only restricted to blood sugar levels. Uh, but there is such a deep connection between mental health and diabetes, is something we are going to explore. So mental health and blood sugar, sound like two different worlds, but science says that they are deeply connected. Uh, so what does the term, the hidden loop, actually mean in terms of medical science?
So now when we examine a person with diabetes, we no longer call them patients. We call them a person with diabetes, or we call them a person with obesity.
Right.
So we talk to them about the connection between the two ends, that is mind and metabolism.
Right.
And both of them have a very let's say sort of a self intertwined relationship. A person with a disorder which has been labeled like a dangerous disorder all of these years,
Right.
you diagnose that person and tell him or her that you are now a diabetic person and you'll have to be on tablets all your life. Imagine the plight of that person.
Very true.
That add-ons to the anxiety and disorder, depression, sorry. And a lot of people still don't understand how important mental health is, and not just for somebody with diabetes or obesity, but even for normal people like you and I.
Right.
Sitting through something like an interview like this could be as perceived as an anxiety situation for somebody.
Right.
Depression, on the other hand, is a constant state wherein you're not able to process the feelings that you have.
Right.
It's not always sadness, it's not always anger. It might precipitate in different ways. So now when we talk about these bigger disorders of anxiety and depression in correlation with hyperglycemia, not just diabetes, I'm talking about hyperglycemia and hyperinsulinemia or metabolic disorders, they are so closely connected to each other that for a person who is, let's say, suffering from anxiety and depression, may or may not know that he's having those
Very true.
mental conditions,
Very true.
he or she might have a dysglycemic condition or say have a deranged metabolism.
Right.
On the other hand, somebody with a deranged metabolism, say his or her body produces a lot more insulin, there is dysfunctional adiposity, there is central or visceral fat deposition. All of those people, in a way, have so much of prejudice running around them in terms of, say, body shaming, somebody calling them, ab to mote ho. And that's a very common thing. Hey,
Yeah,
mote,
yeah.
meri baat to suno.
So casually said.
It's so casually said. That impacts the person's body image.
True.
That leads to anxiety, that leads to depression. A lot of women have that perception about themselves that they are not beautiful. They might feel that a certain level of obesity is their fault. They might feel that the diabetes, the hyperglycemia that they have is their fault. So this is a hidden loop that nobody addresses well. It needs to be, let's say, diagnosed, brought to the surface, addressed in the most appropriate format, so that one does not spill over to the other side to disturb the balance that the body, the nature has given us.
Right. Right. So it is all about what I get from what you said is it is not only about just reading the reports and addressing the numbers. There is a lot more thing which is under the carpet which needs to be brought up and needs to be addressed so as to ensure that the numbers can get into place faster than ever. Wow. So, ma'am, this explanation, really uncovers something most people never think about. The mind and metabolism are deeply interconnected, as you said. It proves that health is not just about the food or exercise. It's also about emotions, response to stress, and mental balance.
It is.
So, ma'am, this takes me to the next question that anxiety and depression are often described as, emotional struggles. But what many people don't realize is that they also create a physical stress response in the body. And ultimately, as you mentioned, imbalances in the sugar levels can be because of that. So, why are anxiety and depression so tightly connected and blood sugar imbalance?
So, if we talk on a little bit of a medical ground, whenever somebody has a sort of an anxiety, what it does, it increases your stress level hormones. So, those are the cortisol and the adrenaline.
Okay.
They are anti-insulin hormones. So, whenever there are anti-insulin hormones which are very active in your body, you will have some sort of a dysglycemia. Because on the background, somebody say above the age of 25 or 30, we are all Indians, we have the epigenetics, which are predisposing us to insulin resistance.
Right.
So add on to that, on top of that, if there is anxiety and increase in cortisol levels or adrenaline levels, that is going to give you some level of high sugars. So now there is a terminology known as stress-induced hyperglycemia.
Okay.
And that happens to a lot of people when they have to undergo a certain surgery, or a lot of people come to us and say that उस time पे मुझे stress था, that time I was diagnosed with diabetes, उसके बाद वो चला गया.
Okay.
So that's not how it exactly occurs. It's the stress which unmasked the hyperglycemia, because at that point somebody did run some test on you.
Right.
So that's how the anxiety is impacting through the anti-insulin hormones. When we talk about depression is a little complex to connect with the dysglycemia. Long-term depression causes inflammation in the body. That inflammation triggers the certain chemicals, the biochemicals into your body, again, which leads to insulin resistance.
Okay.
So that insulin resistance again impacts your sugar levels.
Oh.
And that sugar levels causes again hyperglycemia,
Right.
which makes you predisposed to get diagnosed with diabetes. So this is how, in a nutshell, we can define to somebody that anxiety and depression are impacting your sugar levels. On the other hand, somebody with diabetes and obesity, and I talk about both of them hand in hand, because majority of the people with type 2 diabetes, and I'm only talking about type 2 diabetes when I say this,
Right.
they are obese. Even somebody with a normal BMI of say 23 and below might have a higher fat percentage in our Indian scenario.
True.
So we are all thin fat Indians.
Right.
So somebody with diabetes and obesity might have anxiety and depression because their high sugar levels, like you just said yourself, that there is an emotional manifestation, there is a physiological manifestation, there is also a physical manifestation of the entire continuum of the sugar complication or the diabetes complications that are not addressed well. A person with diabetes has an economic burden.
That's so true.
And that person is always going to think about, कितना खर्चा होगा, when do I have to again go to my doctor, वापस reports कराएंगे, वापस मुझे यही करना है. Somebody with complications of diabetes or complications of obesity again has, impact on the quality of life. So when somebody will tell you, oh, आज ये आप नहीं खाना, you are a diabetic, how would you feel?
Right.
So that is how that diabetes is again precipitating the anxiety and depression for that person on a long term.
It's a loop.
It's a loop, and it's a loop which is so difficult to break, because it's not just the doctors, or it's not just that person also, it's a society as a whole.
Very true.
It's the family, the society, even our environment, and the government also. You have to imagine how serious this is, because the government of India has now mental health platforms which are free of cost available. So everybody recognizes that it is something that needs to be seriously taken care of. But somewhere we are unable to identify or come out saying that, there is something wrong with me, please help me.
So true. So true.
So that's some place, maybe through this podcast, we can put it out to the people that it's okay to come out and say that I'm not okay and I need help.
Very true.
And it's very confusing for somebody going through the entire process with or without diabetes. If, let's say, they are just, having a traumatic incident, and say their parents are also diabetic, there is a caregiver's distress as well. So let's say if both of your parents, God forbid, they are diabetic and they have, some of the other complications, or even without complications, it's a lot of pressure, a lot of work, additional work, to take care of them. So that's an entire loop that requires to be addressed.
So true. So, ma'am, when we talk about, per se any conditions related to mind, viewers at large, majority would know only two terms, anxiety and depression. Is there anything else as well which needs to be addressed? Or I think these two are the major things which address well can also take care of the other physical conditions.
there is something known as a diabetes distress. There is a it is a standalone separate entity other than anxiety and depression. It is a little tad bit little different because when we talk about diabetes and its relation to both of these disorders, they may or may not be present in the same exact clinical format.
Right.
So we call it a diabetes distress.
Hmm.
That happens because of the condition itself, because your sugars were not good, either they were fluctuating, you had some sleep disorders, you were not able to function as well physically as you used to before the disease was diagnosed. So that's
Right.
the terminology that we now use, and it's called diabetes distress. There are special questionnaires which are out in the open. Anybody can Google that questionnaire up, answer those. If they are positive, go to your doctor, go to your healthcare professional, and ask them that what needs to be done about this.
Right, so true. So, ma'am, do you also see cases where you get the sugars in check also leads to better mental health, or rather it eases out the anxiety depression?
Absolutely. So I'll to everybody listening to us today, sometimes we have brain fogs. Sometimes you're exhausted.
Right.
You're fatigued. Some days you sleep well. Some days you don't sleep well. For a person with diabetes, this is a routine cycle.
Hmm.
And it is not precise कि आज नींद आएगी कल नींद नहीं आएगी ऐसा. Nobody knows that.
Right.
So you imagine a person on top of taking care of him or her, on top of taking care of the family, taking care of the career, is also going through this.
Right.
You are unable to process some information.
Hmm.
All of this is happening to that person because their sugars are fluctuating. So there is a direct correlation. There is research which has been established that there is a connection between glycemic variability, not just hyperglycemia, but the plus and minuses of sugars that are going
Right.
to the mental health, to anxiety and depression. And once you're able to reduce this glycemic variability, give a good sugar control, the energy levels that come back,
Right.
the physical capability that comes back, the removal of the brain fog, that I'm able to process what you're questioning me.
Right.
You're able to listen to me. All those people listening to us are able to process the information जो मैं आपको बता रही हूँ. All of this is what happens to somebody when their sugars are very much under control. And they come with a new zest, they come with a new life. कि, oh my god, क्या कर दिया आपने? If I'm allowed to talk a little bit more on this side, there is also sexual dysfunction that adds on to the anxiety
Right.
and depression.
True.
On the background of diabetes. So this is one very important complication of diabetes
True.
that leads to anxiety and depression, more so in males.
Right.
In females, the trouble is that they are not able to identify it.
Right.
And a lot of males go through this, and at our place at RIMS we have an entire team who they can talk to. So we
Right.
have a counselor, and it is a part of our history taking performer wherein the medical officer will proactively ask the person a question whether you have a normal sexual life or not.
Right.
To the females, we make sure that there is a female asking the question. To the males, we make sure that there is a male asking this question.
Right.
And once their sugars are very much under control, their anxiety, depression is at a very manageable levels,
Right.
this improves.
So true.
And it really gives them such a happy, part of their routine.
Very true.
And they come back very much satisfied. So this is the part where I was telling you that this is the satisfaction that people come back with, and they say you've changed my life, and more so for a lot of people who are young now,
Right.
because diabetes, obesity are there in the
Yeah.
younger population. पहले ऐसा नहीं था.
Right. So true.
Yeah.
So I can only imagine that in a consultation you address what is there, what is visible,
Yeah.
but you address a lot more which is not said and which can be hidden.
You
So,
have to do that, right? It's the person as a whole that you have
right.
to treat, and not just those numbers. So
Right.
it's not just your weight, it's not just your sugar, it's not just your
Hmm.
blood pressure. Those are important, of course,
Right.
but you'll have to bring it out of that person.
Right.
आपको trouble क्या कर रहा है? You know, what
Very
is
true.
your expectation out of us
Very
when
true.
you've come to me for your management? किसी का शक्ल उतरा हुआ है, somebody
Ah.
comes with a different stress, and maybe
Yeah.
spending 1 minute extra in the OPD and asking this, it does make them more comfortable in opening up.
So doctors are more mind readers and face readers as well.
You have to it's a part of the
Yeah,
you
very
know,
true.
physician's training,
So
that you
true.
have to read that person the moment that person is entering into the OPD. You have to see how the person
Yeah.
works, how the face expressions are, how that person is per se. Yeah, so it's a part of our
Wow.
training.
So, ma'am, we talk a lot about family history and lifestyle when it comes to diabetes, but mental health rarely makes into the list. Can long-term anxiety and depression actually increase the risk of pre-diabetes
It does.
or
It's
diabetes, I would say?
Yeah, it's a big yes. Capital letters, bold letters, yes. That long-term anxiety and depression increases your, again, the anti-insulin hormones that we just talked about, the cortisol, the adrenaline, and
Right.
it increases the constant, continuous inflammation in your body. So it's a very consistent, inflammation that leads to the beta cells either getting depleted or dysfunctional, which
Right.
leads to diabetes. And a lot of people are aware of this fact now. It's an urge to everybody, again, that if you feel that there is something wrong with you, get your sugars checked.
Right.
If you have diabetes, get your mental health checked.
True.
And there are very objective questionnaire to get yourself diagnosed with. And for somebody, again, with anxiety and depression, maybe if it is running in the family, if you know that, your mother was going through something and she could not come out and speak about it, if you saw your father who was troubled all the time and was stressed all the time, you need to get yourself checked, because we imbibe all of that from our
Right.
parents.
Very
It's genetic as well as heredity.
Right.
Both of them standing in very different zones.
So true. So true. I mean, that's indeed a wake up call that mental health is, not just a side effect. It can be a major risk factor.
It is. It's a big causative agent.
So, ma'am, it almost feels like a trap. Stress affects sugar, sugar affects mood, and the cycle continues. How to actually work on this vicious cycle and break it?
It's very difficult if you're asking me. Who is not undergoing stress? आप stress में
Yeah,
हो,
everyone.
मैं stress में हूँ. People listening to us are under the stress. ये podcast कब खत्म होगा? मैं कितना सुनूंगा? So it is very subjective. Number one,
Right.
you will have to understand what might be causing stress to somebody, might not be causing stress to somebody else, and it is a trap. You have to very consciously seek help to get out of this.
Right.
You need very qualified professionals who can help you with this. Again, with a objective, if I may talk a little bit more, there's a very wonderful YouTube series which is talking about mental health, and I don't know if I can name it or not, if you allow me.
Yeah,
It's
yeah.
called The Perfect Family. So where the entire family goes through a therapy session because the kid is going through something in the school,
Right.
and it is then that they diagnose themselves that they themselves have been going through some mental health issues. And they didn't know that they were going through something because किसी ने बताया नहीं.
Right.
And saying that I'm going to a therapist or a qualified professional for my mental health help,
That's
it's
a
so
taboo.
stigmatized.
Yeah.
There's so much of prejudice when I say that, I want to take therapy.
Yeah.
More so in the older population.
Very true.
Our generation and above.
Yeah.
The
very
younger
true.
population thinks that it's a
They're
trend.
all sorted, yeah.
They are all sorted. They are very hip about it. That
Yeah.
I need therapy.
Yeah.
Mom, I am going through my boards. I really
Yeah.
want to consult somebody who can help me
Very
get
true.
a little better, come out of my exam
Yeah.
anxiety. With the boards
Yeah.
also coming up, a lot of us are anxious. So yes, it's a very difficult thing to come out of this trap. But there are qualified professionals who can help you. Objectively, get yourself checked for the metabolic parameters. Get your sugars checked, get your blood pressure checked, get your cholesterol checked. Keep your obesity in check. Eat healthier food.
Right.
exercise and be physically active. Exercise is different and physical activity is different. So being physically active all through the day, climbing the steps, being standing a lot around, walking all through the day is what is physically active. Exercising is a very regulated, rhythmic, consistent physical activity, and that is what is exercise. All of these help to help a person, going through all of this in a loop.
Right. So, that this also gives me a clue. I don't know how true it may it be, or the data to suggest that yes, it can be. But the reason that the older generations, they still feel it's a taboo seeking help for any a condition like this, could be also the society difference of joint families to nuclear families, how it has evolved.
Absolutely.
I think that could be one of the major reasons, and I think from our generation onwards, our generation before are sorted. They know that it's a taboo. The generation next are very clear that they need help. So we
Correct.
are the ones who
We
are
are the ones who are
transitioning.
trouble. Absolutely.
And I
It's
think
tough.
if we come out responsibly as a generation, I think it will get things a lot more sorted for the generations to come. So I think also taking a clue from what you said, once identifying that yes, you need help, and then seeking for it is half battle won, I think.
Absolutely
Yeah.
correct. And to the men as well.
Hmm.
Females are much more comfortable
Yeah.
talking about what they are going through.
Right.
And a lot of female have girlfriends also. They talk to their mothers, they talk to their sisters, they
Right.
talk to their friends. Ados pados wali auntie ji se baat kar li.
Ah.
So females have a place where they can spill out.
Right.
For the men to process their emotions,
Yeah.
it is still something that they haven't learned. And they undergo a lot of stress, which is, I think, self implicated,
Right.
or from the society,
Yeah.
or because they feel that they have to behave in a certain manner.
Ah.
रो नहीं सकते, ये नहीं कर सकते, वो नहीं कर सकते. Again, in our generation.
Yeah.
So men need to understand that it is okay to come and seek help.
Very true. Very true. I completely agree to this. So, ma'am, do you see patients trapped in this mental health, blood sugar, blood sugar loop in real life? And can you share your experiences? I think we can all relate that this is a vicious loop. But from your clinical experiences, if you can share certain instances, I think a lot of people who might be going through certain or a similar kind of a situation would be able to relate it better.
So, we have patients who come to us crying.
Oh.
Yeah, अभी मुझे diabetes diagnosed हो गया. This is the end of my life. So all it takes is a proper education.
Right.
That this is not the end of your life, boss. आपको सिर्फ इतना करना है. Timely monitor करो, अच्छा
Manageable
lifestyle. It is manageable.
Yeah.
So it takes a lot of assurance on our part to educate this person and counsel the person with, of course, obesity as well as diabetes.
Right.
If you want to talk about just one single aspect, again, I'll talk about a female, coming to us. And again, our generation, late 30s, already having kids. She says, I'm exhausted all the time. I really do not have the time to take care of myself. You just have to help that lady to put everything into proper time zones. That it is okay to breathe. It is okay to sit down. It is okay to take a minute. Take some time off, take some rest.
It's true.
And don't feel guilty about the entire thing. Your diabetes or your obesity is not your fault. So saying that, cuts the entire noise level in the head.
Right.
And there is so much of overthinking,
Right.
which people do not recognize that it comes because of the deranged metabolism, because of the insulin resistance, because of all the inflammation that is happening in the body, the nutritional deficiencies that are leading to the exhaustion,
Right.
and they want to do everything at once. So once that female was, just explain that this is how you have to take care of yourself.
Right.
Her second and third visits were relatively, it's not an overnight process.
Yeah.
Were relatively better, that she could come and say that this is how much I could do.
Right.
This is how much I am, maybe taking out some time out of my entire day for myself. I'm able to monitor my sugars. They have come within the range. Now I still want to do more so that I can reduce the pill burden. And that is all possible.
Right.
And you just need a proper team to guide that lady, guide that person with diabetes and obesity. So for
Right.
everybody listening, it's of utmost importance that you're explained your disorder, your condition
Right.
very well. You're explained what to do. You're explained what not to do.
Right.
You're explained when to come back to the doctor again.
Right.
So this is all that is of utmost importance. And sitting with an educator, a diabetes educator, an obesity educator, and a counselor who can, maybe just pat your back and say, you've done a good job up till now. It's
Right.
not your fault. Come back to us again and I'll teach you what to do. Come back
Right.
with your troubles, write them down. It's okay. We'll spend a minute more. You don't have to worry about anything else.
Right.
And this is a safe space.
Very true.
These are all really important things to manage both the conditions, diabetes, obesity, as well as anxiety and disorder. So you see, it's how
Right.
balanced on both the sides.
So, ma'am, that's really fantastic. That how RIMS have, as an institute has understood this and created that safe place for the people to come in, and it's not just a setup where there's a doctor-patient thing. It's a holistic approach,
Correct.
Which is being taken care of.
Absolutely. So, Bakaida, there's a person sitting with that person. It's again, we don't call them patients anymore.
Right.
So there is an educator who sits and tells them that you really don't need to feel scared. And it's so overwhelming when we write the prescription कि ये दवाइयाँ है, ये आपको लेना है, आपको ये sugar check करना है. This is when you have to check your weight again. But it becomes very overwhelming. So somebody needs to sit with them and explain that आप शांति से पहले ये समझ के जाओ.
Right.
That doing all of these changes in very tinier steps is going to help you overcome your troubles.
So when someone is diagnosed with diabetes, doctors focus on HbA1cs, medications, diet, and exercise. But mental health often gets overlooked. So should people with diabetes be routinely screened for anxiety and depression? And whether this screening itself creates more anxiety and depression, I don't know. But what should be the approach?
It's very important question, number one. And I feel the doctors ourselves need to be screened for anxiety and depression. And a lot of doctors listening to us, the message should be that, screen yourselves, take care of yourselves first. And for everybody coming with a chronic disorder, be it diabetes, be it obesity, be it hypertension, be it cardiovascular disorder, cancer, any sort of chronic disorder, they need to be screened for mental health. Right. There are scientifically validated tools. There are questionnaires which can be used to diagnose them for anxiety, to diagnose them for depression. Particularly for diabetes, there is a diabetes distress scale.
Okay.
And they have very small questions, only 5 questions. If you are feeling low, how has been your sleep all of these days? How do you feel that you rank yourself in terms of, any overthinking process, in terms of any suicidal tendencies, in terms of, not able to do something for yourself.
Right.
So just 5 easy questions, you answer them. Even if more than 3 are on the correct side, the doctor or the educator, will flag this person that the doctor has to spend a good amount of time talking about the mental health with this person.
Wow. So there are easy tools available.
Easy tools available,
okay.
Yes.
Right. So we have covered science, real world impact, prevention, and hope. Before we wrap up, if our viewers remember just one message from today's episode, one truth, that could change their mindset or health, what should it be?
So it is breathe. Nothing is the end of the world.
Right.
Focus on the controllables.
Right.
A lot of our famous cricketers have said this. Only focus on the controllable. आपके हाथ में जो नहीं है, you cannot do anything about it.
Right.
But it is in your hands how you take care of your today, how you take care of your tomorrow. And do not hesitate to ask for help. It is a very difficult task for, again, us and the generation above to ask for help. But please don't hesitate to do that. And there are qualified people. Seek help from qualified people.
Right. So it's important to speak up.
It is important to speak up. Absolutely. Yes.
Wow. So that message is really powerful. Mental health and blood sugar are not separate battles. They are part of the same story.
Yeah.
And this conversation, reminds us that taking care of mental health is not a luxury. It's a medical necessity. And managing blood sugar isn't just about numbers. It's about protecting energy, mood, focus, confidence, and long-term well-being. A heartfelt thank you to you, ma'am.
Thank you so
Uh,
much.
we are grateful for your guidance and for helping us understand this complex but crucial topic in such a clear and a compassionate way. Thank you so much, ma'am. And until next time, this is Azkka What You podcast, where awareness meets action.
Thank you to the Azkka Virtue podcast for having me. And this is ultimately the truth that a person needs to be well. And wellness means physical, mental, spiritual, financial, as well as environmental wellness.
So true. So true. It was such a pleasure to have you, ma'am.
Thank you so much. Thank you for having me.
Thank you so much, ma'am.